Of the 9 shoulder dystocias that I have had, none of them were an emergency.
What is dystocia, first of all?
Well, a dystocia is anytime a baby gets stuck somewhere, and they can get stuck in a number of places inside the pelvis and not always on a bone. The head can get wedged funny, or maybe they've got a hand and they're tilted. And so, but the dystocia most people think about is a shoulder dystocia. And that is where, when that baby's head is born and then they're trying to rotate, or maybe they do rotate, baby's out, their shoulder is behind the pubic bone, and you could see that baby is not going to get born just like that. Since I'm a water birth expert, it's my passion. Let's talk about this in relationship to a water birth. If I suspect somebody might have a shoulder dystocia because they've had one before, maybe they just kind of make bigger babies, maybe the shape of her pelvis tends to lean towards that, I'm gonna really ask her to consider birthing in the water 100%, because I have a lot more time to sort that without it being an emergency. Of the 9 shoulder dystocias that I have had, none of them were an emergency. The babies were stuck, but because we kept the head under the water, we did not initiate the breathing reflex, which gets initiated the moment that the head starts to come into the atmosphere.
So when there's a clock starts, isn't it? Where if you get a dystocia out of the water on a land birth, then you've got a clock, haven't you?
And again, like what we talked about, in a water birth setting, your clock is more based on how the baby's doing and what.
Because it's not breathing, it's underwater anyway. So there's no the breathing reflex hasn't kicked in, which is when you lift the baby out. So you don't have this clock.